When your knee hurts, the first thing most people do is search online or on YouTube for a solution. A lot of videos will tell you to strengthen your glutes. That may help, but knee pain has many causes, and strengthening the glute may not be the only answer. In this video, we break down the possible causes, give you a simple way to identify which pattern you might belong to, and if exercises can give you relief, we have a few to suggest. By and large, there are 5 key causes of knee pain: structural wear and joint disease, injuries and mechanical damage, soft tissue and overuse problems, biomechanical and movement pattern issues, and systemic and load-related factors. We will briefly explain each one, then share a simple self-diagnostic to help you roughly figure out which pattern you fall into. If you belong to a group where exercise can provide relief, we will share a few exercises to try and a simple weekly plan to follow. The self-diagnosis part is the most important. Most people skip straight to exercises and wonder why nothing changes. Stick with us through the 5 causes. It takes less than 2 minutes, and the self-test at the end will tell you exactly where to focus.
First, let's look at structural wear and joint disease. This refers to osteoarthritis, where the cartilage between the bones wears down. You feel stiffness, aching, and pain that builds with activity, especially after sitting for a while or doing a lot of walking. It can feel worse in the morning, then loosen up a bit once you start moving. Other types of arthritis, like rheumatoid or gouty arthritis, can involve heat, redness, swelling, or sudden flares. Second is injuries and mechanical damage. This is when something actually tears or breaks inside the knee. Ligament tears like ACL or MCL often happen after a twist, a sudden stop, or an awkward landing. You might hear a pop, see swelling within a few hours, or feel like the knee might give way. Meniscus tears involve the cartilage shock absorber inside the joint, often from twisting, deep squatting, or heavy lifting. You might feel sharp pain, catching, or a sense that the knee gets stuck or locks. Fractures or dislocations are usually obvious after a fall or trauma, with severe pain, deformity, or an inability to walk on that leg at all. Third, soft tissue and overuse problems. This includes tendinitis or tendinopathy, like patellar tendon pain under the kneecap, or hamstring-related issues that come from running, squatting, or jumping. It tends to build slowly with repetitive loading. You might also get bursitis, which is inflammation of the fluid sacs around the knee, often from prolonged kneeling or pressure on the front of the joint. Another common pattern is iliotibial band syndrome, or IT band syndrome, where a tight band runs down the outside of the thigh and rubs over the knee, causing outer knee pain in runners or cyclists.
Fourth is biomechanical and movement pattern issues. This is where the hip and glute muscles come in. When the hip cannot control the pelvis properly, the knee often caves inward, putting more pressure on the kneecap and the outside of the knee. Weak glutes and tight hip flexors can tilt the pelvis and change how force flows through the joint, even if nothing inside is torn. Foot or ankle problems, like flat feet or pronation or old ankle sprains, can also change how your knee moves and how much stress it has to handle. The last one, the 5th, is systemic and load-related factors. Excess body weight increases compressive load on the knee, which can speed up wear and tear. Overuse or sudden load spikes, like suddenly doing long hikes, deep squats, or long runs when your body is not used to it, can trigger tendinopathy or bursitis, even if the structure of the knee is mostly fine. Sometimes an old knee injury that never fully healed or was never properly rehabbed can leave the joint subtly unstable, making it more prone to pain later on. Hope this gives you a picture of the different scenarios that can cause knee pain.
Let's now go through the self-diagnostic test we mentioned at the beginning of the video. If any of the next situations sound like you and your knee is bothering you, pause and think about whether you should see a doctor or physio first. Your pain started suddenly after a twist, fall, or heavy lift, and you heard a pop or loud noise. That is a red flag. Swelling came up within a few hours, which is a red flag. The knee feels like it might give way. It locks or gets stuck. You have big redness and warmth around the joint, or it is extremely painful to stand on that leg. That is where you stop and get checked before loading that knee with exercises. If you do not have any of those red flags, two other patterns that you can check. The first pattern is a hip and glute-driven pattern. The second pattern is more about cartilage wear or early arthritis and overuse. For the hip and glute-driven pattern, if your pain is mainly under or around the kneecap or on the outer side of the knee, and it hurts with stairs, squatting, or standing up from a chair, but you do not remember a specific injury. If it gets worse after long sitting, like at the movies or at your desk, and then improves a bit once you walk, that is another clue. If you feel better when you stretch your hip flexors or do gentle glute activation drills, that is more evidence. And if, when you stand on one leg, your pelvis drops or your knee drifts inward, that is a sign your hip and glutes are not controlling the knee well. To test that safely at home, you can stand near a wall, lift one foot, and balance on the other leg for about 10 to 15 seconds. If the standing side pelvis drops, your knee caves in toward the midline, or the whole thing feels unstable, that is a sign that your hip and glute control is weak. If this sounds like your situation and you do not have the red flag signs, strengthening the hip and thigh muscles can help take some pressure off the knee and make stairs and squatting feel easier. The second pattern is more about cartilage wear or early arthritis and overuse. If you are over 40 or 50, or you have done a lot of heavy squatting, running, or prior knee injuries, and your pain builds gradually with walking, stairs, or standing, feels stiff in the morning and sometimes loosens up, this might be you.
You might not see much swelling, but the joint feels gritty or creaky. In this case, cartilage wear or early arthritis may be involved.
Strengthening your thigh and hip muscles can still help by improving load sharing and stability, but it is not going to regrow cartilage. You should combine strength work with load management, and if the pain is high or worsening, get a medical or physio check. Now, if you are in either of these groups, the hip and glute-driven pattern or the cartilage and overuse pattern, and you do not have those red flag symptoms, you can safely use strengthening exercises as a way to support your knee, not as a miracle cure. Think of it like this. We do not know the exact inner cause of your knee pain, but if you have weak hip and thigh muscles, strengthening those muscles helps improve knee control and often makes walking, stairs, and squatting feel easier. It can make almost every knee healthier and more resilient.
We are now sharing a simple 6-week bodyweight program that focuses first on the hip and glutes, then on the thigh, and finally on real-world tasks like stairs and sit-to-stand. The idea is not to chase pain or push through sharp spikes, but to gradually build strength and control so your knee does not have to do all the work by itself. Here are a few simple exercises to get you started. Glute bridges, side-lying hip abduction, and sit-to-stand. Clamshells, and mini squat to a chair. Step downs, single leg balance. And as you progress, do squats and longer walks. The full 6-week progression is on screen now. Many people notice improvement in about 6 weeks, though some need longer, depending on pain severity, how long the issue has been there, and how consistently they train. Here is a simple progression from 0. Week 1. Reduce anything that aggravates the knee. Start gently. Glute bridges, side-lying hip abduction, and sit-to-stand. Week 2. Add clamshells, mini squat to a chair, and short step-ups. Week 3. Increase reps or sets. Add split squat with support and introduce slow step-downs. Week 4. Progress the depth slightly. Add single leg balance. Weeks 5 and 6. Increase load and volume. Build tolerance for stairs, squats, and longer walks. Many people have knee pain and are quick to jump to a fix, but it is critical to understand the root cause, as it is not always the same.
Knowing which pattern you fall into is half the battle. If you have the red flag signs we mentioned, get checked first. If you fall into the hip and glute-driven or the cartilage and overuse pattern, The exercises and the 6-week plan are your starting point. Start gently, stay consistent, and let the strength do the work. Train smarter, not harder. Thanks for watching.